Let's start with the children who are born premature. Can you tell us more about retinopathy of prematurity? Hi everyone! Today, we're going to talk about eye diseases and vision problems in young children. I have here with me Dr. Michelle Dagta Alabata, a pediatric ophthalmologist. Hi Dr. Michelle!
Hi Doc Don.
So, since we're talking about pediatric cases and eye diseases in very young children, let's start with the children who are born premature. So, mommies and daddies who have premature babies, it's important for you to bring your child to a pediatric ophthalmologist because there's a high risk that your child has retinopathy of prematurity. Can you tell us more about retinopathy of prematurity?
So, retinopathy of prematurity, it's a disease in the retina in premature babies, usually those who have underdeveloped retinas and those who have untoward clinical course, those who experience oxygen deprivation during birth, and also those who have low birth weight. So those are usual criteria in having retinopathy of prematurity. Included also are those babies who underwent blood transfusion, which they needed naman, but those are risk factors kasi of retinopathy of premature, especially those who are given birth mga 32 weeks and below.
Oh. Yung anak ko kasi nag-blood exchange transfusion siya because my daughter had ABO incompatibility when I gave birth kasi my husband is type AB and I'm type O. Tapos nag-blood exchange transfusion siya and we weren't advised that time to bring her to a pediatric ophthalmologist. I should have done that.
Not technically, as long as the patient was given birth at a normal time, or parang it's mature naman. So that would be 37 weeks and above. So we don't need naman technically to have their eyes checked.
Kapag normal yung birth at saka kapag full term.
Full
kahit
term,
na
yes.
Transfusion.
Yes, full term because we expected that the retina is fully developed kapag 36 weeks na nasally and then around 39-40 weeks temporally. So technically, if the baby is full term, we don't usually need to see them unless they were given birth earlier and then low birth weight, and then those who suffered from pneumonia, that's why they have oxygen deprivation, they have lung problems as well. So those are the risk factors for retinopathy of prematurity.
How about, Doc, yung mga hindi sila premature, normal yung full term sila, pero low birth weight?
We can take a look at them if they really want us to. Pero since we call the disease retinopathy of prematurity, one of the major factors talaga is yung prematurity. But for those who have low birth weights and then they have untoward clinical courses in the NICU or in the neonatal intensive care unit, we could still check them for other possibilities.
So, ang next question ko naman, Doc, if a child has retinopathy of prematurity, ano yung vision ng batang yun?
Very good question, Doc. So, actually, it depends on the stage of retinopathy of prematurity. So, there are stages of retinopathy of prematurity wherein it could subside on its own. We just need to observe it. But there are stages, usually latter stages, yung mga stage 4 or stage 5, wherein the patients experience retinal detachment. Of course, we would expect na mas poor yung vision nila.
So, how do we manage a patient who has retinopathy of prematurity?
So, aside from observation, dun sa mga earlier stages, As what I have said, it really depends on the stage of retinopathy of prematurity. If we see that there are really abnormal blood vessels, we could do injection, we could do laser. But if there is a detachment already, we refer them to our retina specialists. And they're the ones who are addressing it. So usually surgical na pag later stages na.
So mga how old po yung bata na pwedeng i-inject or pwedeng i-retinal surgery?
As long as the patient is clinical course or very stable na. Siyempre, we don't want naman to perform any surgeries kapag hindi pa stable yung baby. So usually, yun nga yung mga pangit sa NICU na clinically. So we don't really operate them on them agad. We need still the clearance of the pediatrics. But as early as much as possible nga, for example, we saw that there is retinopathy of prematurity and then medyo late stage na, within 72 hours, kailangan matreat na po natin sila talaga.
Okay. So how about those patients who were diagnosed with retinopathy of prematurity and they are in their advanced stage and they should have their procedure, their management done within 72 hours, pero hindi nagawa? What's the prognosis? What will happen to them?
Of course, there is a lower prognosis that their vision could be improved later on, but the retina specialist naman would still try if they see that there is a tiny hope that they could save the eye, lalo na if the retinopathy of prematurity falls on both eyes. At least we could save an eye para maging functional yung bata.
I've actually encountered a lot of pediatric patients na nasa category na ng low vision because they had retinopathy of prematurity and then some were addressed pero residual vision na lang. Meron din namang iba na hindi talaga na-address and then they had very poor vision. But good thing is when we do low vision rehabilitation on them, we can still provide and maximize the residual vision that they have, and we are able to let them function normally just like other kids. They can go to school. Yun nga lang, they cannot see as well as kids their age. We have to make some adjustments, pero it's not a hopeless case.
Yes. And as long as we can save an eye and there's a residual vision talaga, yun yung po pwede nating i-maximize.
Yes, that's right.